Hello friends, lot of patients come for consultation in our OPD about the problem that they feel as if they are going to leak urine. They commonly express anxiety in the phrase like, when I have got to go, I have got to go. Or when I want to go, I have to rush because I think I may wet myself. So fear of leakage is an important concept to these patients. So let's talk about overactive bladder. It is not a disease. This is a group of urinary symptoms. Overactive bladder is a symptomatic diagnosis. OAB is defined as urinary urgency with or without incontinence, usually with increased daytime and nighttime frequency. Now we discuss about symptoms. Urgency. Urgency is a condition when patient feel a sudden urge to urinate which is difficult to control. Urgency incontinence is unintentional leakage of urine. They may be associated with urgency. Daytime frequency of micturition is more than 7 times and patient has to wake up more than 2 times in the night to urinate. All these symptoms disrupt the life of patient by causing depression, anxiety, sleep disorders, which ultimately affect quality of life. Now we discuss what are causes of overactive bladder. Overactive bladder can happen when brain signals bladder to empty even when it is not full. Overactive bladder can also happen when the muscles in the bladder are too active. These bladder muscles contract to pass urine before they should. This contraction causes the sudden strong urge to urinate. There are certain conditions which contribute in signs and symptoms of overactive bladder like diabetes, neurological disorders, urinary tract infection, hormonal changes during menopause, bladder tumor, stones, enlarged prostate, constipation, excessive consumption of caffeine and alcohol, and aging of the patients. Now, how to prevent this overactive bladder? A healthy lifestyle may decrease the risk of overactive bladder, which includes maintain a healthy weight, regular physical activity and exercise, limit the consumption of caffeine and alcohol, and quit smoking. Now the management part. Proper treatment of a associated disease like diabetes. Do pelvic floor exercise, that is called Kegel exercise. Carefully manage fluid intake. Visit bathroom at a scheduled time during the day. Keeping a bladder diary, which help in identifying trigger factors. How to maintain the bladder diary? Keep bladder diary for 3 days and write down how much fluid you drink and what kind and time. Also write down time and volume of voiding urine. Also note leakage of urine when and where and how many pads you have changed. Use incontinence pads to avoid embarrassment. Bladder training means start by urinate at set interval such as say every 30 minutes to every 2 hours. Whether you feel the need to go or not, gradually increase the time between each urination by 30 minutes until you are urinating every 3 to 4 hours. You can manage symptom of overactive bladder with these simple behavioral strategies. If these initial efforts do not decrease symptoms of overactive bladder, there are additional treatment available like medication and surgery that might help you. It is not easy to discuss about overactive bladder, but if it is existing, they are distressing or affecting your quality of life. Talk to your urologist for advice. Stay active, stay fit.